My approach in listening to women and birthing people was very informal to begin with. I wanted to create a space for women where they feel safe to bring issues to the fore. Pelvic health issues is something that brings a lot of embarrassment for women and a lot of stigma. And so I wanted an informal method to engage with them. We decided to do some coffee mornings. And also because we were coming at the end of the pandemic, we also did some engagement online. We ensured that the groups were small, but also we had our physiotherapists come into all of these sessions so that women could bring up any issues or could potentially find out information about how to refer to different areas. So I came to these engagement sessions with a very open mind. So we didn't have a very set agenda about the questions we wanted to ask from women and birthing people, because we really wanted them to be honest about all the issues that were affecting their pelvic health. So we approach any women who would have a baby over the last 5 years within those communities. And we really were very open to understand the challenges and also understanding what they knew about pelvic health and how to find help, but more importantly, to understand what were the most common problems they were encountering when they were trying to seek help. It was also very important for us that we speak and communicate with women in their own languages. So some of the sessions that we develop, we brought native speakers. So we had a physiotherapist, for example, who speaks Spanish. We also have a physiotherapist who spoke Arabic. And we also, when we develop these sessions, we have an interpreter. For example, when we went to the refugee settlement project in Lewisham and the mosque, we had people present from their own communities and their own organizations who could act as an interpreter, because it was very important that we could also communicate with women who didn't speak English. So when we went out and started speaking to women and birthing people, um, to be honest, I already had some ideas about what people might tell us, which is often very common as a clinician. You're already trying to guess what people might have on their mind. So personally, I have to be very open and try to get all of those questions out of my head so I could truly listen and be curious about what people had to say. Some of the things that people told us, which was probably not a surprise for many people, is that they didn't really know where to find help. Navigating the NHS healthcare system is very difficult for some women, particularly from the women that we engage from. They didn't know whether they needed to go to the GP or a gynecologist. There was a lot of confusion about the roles within maternity, especially in the community. So some women didn't really know the difference between a midwife, a health visitor. And the other thing that was a really important thing for me to find out was that for a lot of communities, they really didn't understand the role of the physiotherapist in pelvic health. Most people, when they think about a physio, think about rehabilitation that you have to do, for example, when you injure a leg or an arm. So this was very important information. I also find out that there was a lot of lack of information for women and birthing people from different communities in their own language. And also sometimes people felt that the information or the questions were not asked. So even though they had pelvic health issues, they were not asked by the clinicians, either the GP or the health visitor or the midwife, about pelvic health. And because there was that embarrassment and that stigma associated with it, people really didn't bring the issue forward. And finally, I think, which is very important, is that a lot of people within this community and actually the wider community, because we did also a survey, which told us that a lot of women thought this was normal. This was part of giving birth, that women had to suffer incontinence, for example, after having a baby. And that was just part of being a mum.